Minister of Health Patty Hajdu, the MP for Thunder Bay Superior North, joins us to talk COVID. It's James with NetNewsLedger. Joining us by Zoom is Minister Patty Hajdu, the Member of Parliament for Thunder Bay Superior North and Canada's Minister of Health. Welcome back.
Great to see you, James.
What a week. We're seeing our COVID numbers in Thunder Bay push into what many are asking to be put as a hotspot. The people are and the mayor is. What can we be doing better?
Well, listen, after a year, we know what we need to do to bring those numbers down. And they're not just numbers, by the way, they're people getting sick. And for every person that gets sick, there's a chance that that person will end up hospitalized or worse in ICU. And so that's why this is such a treacherous situation, because we can't really predict who's going to get really sick. I mean, we know, for example, people who are older or have underlying health conditions are at more risk than the average person. But sometimes young people or even what seem like perfectly healthy people get really sick. And so we really can't take that chance for ourselves and for our families. It's the same message, and I know people are tired of hearing it, but it is stay at home as much as possible. Don't go out socializing. We're not supposed to right now anyway, according to the gray zone, socialize with other members of other households. So it's a good time to keep doing the things that we've been practicing, washing our hands. If we're sick in any way, stay home from work. If you are one of the ones that are out having to go to work, make sure that you're watching yourself, monitoring your symptoms. You know, a lot of the spread is happening it's in workplaces and in more congregate living types of settings. And we know that when people are feeling unwell, it can be hard to sort of tell if you're just tired that day or if maybe you are getting sick. Err on the side of caution and reach out to the health unit, and they'll give you a good indication about whether you should go get tested or not. There is more testing available and the lineups are not long, so people can get tested if they need to. And it's important that we do that so we can protect each other.
And I think, Minister, I want to thank you for putting it in those terms as people, because over the course of the past year, it starts to just become numbers, and it really is people. I had a call the other day, and a person that I know who has COVID was in hospital, going into ICU, and just his comment was very simple. He said, I got careless. And, stop worrying about the masks and the washing his hands. And I think it is a very personal issue, when we think of it that way. It really hit me when I heard him talking. And the putting it into people cases is so important.
Well, and because we haven't actually had a very high degree of spread here in Thunder Bay, or even really in Canada, we're the second lowest in the G7. Japan is under us, but actually we don't have the kind of cases that we've seen in other countries like the UK or the US or even France and Germany and some of the European countries. So because of that, many of us don't know anyone who's been sick with COVID. So it's hard to believe in a way. I understand that. And people say, I believe it's real, but it doesn't really seem like a threat when you don't know anyone who's been sick or you don't even really know anyone who's had a close call. But you're right. As soon as we start to really understand these are people and families, their lives are upended when someone gets sick. And more than that, oftentimes people are ending up hospitalized. And of course, our hospital is in sort of a full state of distress because of the number of people that are hospitalized and in ICU. So as you know, the hospital is moving people around to other hospitals because we don't have extra hospitals in the Thunder Bay district. This is our large hospital, and we need to protect the capacity of our healthcare system too.
Now, we're starting to get word of a third wave. What's happening? What do we need to be sharing with our readers and viewers?
Well, the number of cases were coming down dramatically after Christmas, and we started to see a decline, especially after Ontario put into place further restrictions. They were really worried, if you remember, after Christmas. There was a surge in hospitalization all across the province, and the province of Ontario added additional public health measures to try and bring the number of people getting sick down. Now, of course, some of those measures have been relaxed, and also coincidentally, we see the variant from originally identified in the UK starting to catch wind in some of our communities, and that variant is purportedly more infectious. Research is starting to really come to some consensus that it is indeed more infectious, and there are questions around how much more infectious it is, but I think people are starting to concede that it is more infectious. Now, what does that mean? It can't go through brick walls. It's not going to jump from building to building, but it just means that if, let's say, 3 out of 5 people got sick before, it might be the entire household. So it has the ability to infect people more quickly in close quarters. So that's why we have to be careful. And I know that here in Thunder Bay, we've identified a few of those cases, thankfully not a lot. The best way to beat the variants is to not let COVID spread. There's no magic to this. It's not a magic virus. It's really just the work that we have to do to prevent the number of people getting sick. In fact, that's how variants come about, is that the virus is let loose in places like Brazil and the UK. In the US, they have a number of variants that they're monitoring there. And when the virus has a chance to grow that quickly and infect that many people, it also has a chance to get better at what it does and adapt. It is also adapting and learning about its host. So this is why we have to be so careful.
That's a really solid message to share, because I know it feels hard sometimes to be, locking yourself in and not going out, and it's starting to get warmer out. So, we want to put the barbecue on in the backyard. We want to have our friends over that we haven't seen. So it's tough. It's really, really tough.
Well, I think summer will give us a relief. Like, we do know about the virus, that it's less transmissible in outdoor spaces if you're following appropriate distancing. We saw in the summer that people were able to gather in small numbers, for example, in the backyard, by spreading out a bit, by socializing outside. In fact, that was much safer than socializing inside. And I can see a return to that, especially as things warm up. But right now, what we need to do is take this opportunity in the next several weeks, while we see vaccination ramping up across the country, to really protect each other and prevent people from getting sick. It's not much longer that we have to do these kinds of very significant measures. We're talking 6 or 8 weeks. We've got millions upon millions of vaccines arriving over the next several weeks, well into the end of May. And then in Q2, which is April to June, 20 million plus vaccines from a variety of different suppliers. What does that mean? It means we've got a really powerful tool in our toolbox to save lives. So we just have to get through these next several weeks together and continue to protect each other and be cautious while the vaccination takes hold across the country.
So maybe the message is, after a year of putting up with this, the light at the end of the tunnel is actually a light at the end of the tunnel.
It really is. We're seeing, for example, Canadian evidence that we've got about 85% of those people living in long-term care homes vaccinated right now across the country. So that's good penetration into a very vulnerable setting. And what we're seeing now is that when the virus is entering those settings, and it still is getting in, it's not causing the same kind of destruction that it was causing prior. So people are still getting mildly ill in some cases, but we aren't seeing hospitalizations and deaths. That's amazing. That's the amazing thing about science and vaccination, is that it is going to actually start to help us resume our normal life, because people that are most vulnerable from getting sick with COVID-19 will have protections that prevent them from death.
That's a good message to leave on, and I'll leave it open for you to close out with a message for Thunder Bay Superior North.
Well, just to the people living in our region, hang in there, because we do need to kind of work together on this. This is a community project. No one person has the answer. No one tool is going to fix this, but we have some very powerful tools coming along, like vaccination. And what it's going to take is all of us working together to get to that place where we're all safe together.
Minister, once again, I want to thank you for taking the time to share with our readers and viewers.
Great. Thanks, James. Have a great Thursday afternoon. Had to remember what day it was.
To keep up to date, you have to subscribe. You have to hit that like button and hit the notification to stay in touch.